my name is Tasha Stanton, and I work as an Associate Professor of Clinical Pain Neuroscience at the South Australian Health and Medical Research Institute here in South Australia, and I also work at the University of South Australia. I started out as a physiotherapist. I was trained in Canada and began to work actually after I graduated at a workers' compensation tertiary care unit. So we saw people that had tried different services like physiotherapy in the public, hadn't gone so well, and they were referred to our unit. So as a new grad, it was a really challenging area to start. You've got really complex cases, and you also have a lot of other mitigating factors that are influencing whether people are getting well or going back to work. And during that time, I really realized how many questions I didn't have answers to. And to me, that just compelled this journey into research. And I quickly realized how much of a nerd I am and that I was in the right place. So I ended up doing a master's in basically looking at spinal biomechanics, actually studying back pain at University of Alberta in Canada. And from there, then got a scholarship to do my PhD at University of Sydney, where I studied basically how we choose what treatment to give to what person and at what time. Again, studying back pain. And then I fell in love with the area of pain neuroscience. So this idea that the world isn't necessarily what we think it is. There are so many things that influence our perception of the world around us, but also of our own bodily experiences. And that really led a journey through, different postdoctoral fellowships, through Canadian institutes, as well as National Health and Medical Research Council here in Australia, and allowed me to really develop a career where what I get to do every day is ask those questions of why does pain hurt so much? Why does it last? And what can we actually do about it? And for me, that has been an excellent journey. It's always a bit hard, but one in which I think we can really make a difference to everyday people's lives. My current work is really trying to see how we can improve care for people who have chronic pain. And I've really been focusing on people who have painful osteoarthritis. We're looking at different technologies. So we're trying to understand if we can use things like virtual reality or mediated reality to make exercise feel better or to make the joints hurt less. I'm also doing work in the area of more complex interventions where we're trying to understand what happens if we give people a really good education and understanding of their own pain. Will that help them to better engage in life and get back to doing valued activities? And we're exploring that in people with painful knee osteoarthritis. And some of my newer work is exploring how we might be able to make the surgical experience better. So when people undergo a total joint replacement, how can we ensure that they get the best outcomes possible? Well, I'm a nerd, so that helps immediately. But what I love about this is that this is an area in which we thought we had, pain or osteoarthritis sorted. We thought we knew what it was. You just take a scan, you look how bad it's damaged, and that's how you know what a person's future is going to be. And yet, when you dive in, you realize that that isn't the case. The contemporary understanding of pain and of these different conditions like osteoarthritis show us that it is so much more complex than that. And the fact that it's complex, that sounds like it might be a bad thing. It's such a good thing because it means it opens up so many different avenues for treatment. So I get really excited that I happen to be here at this time when we're starting to embrace this complexity. But I also get really excited because seeing the new generation of researchers come through that I have the pleasure to get to mentor and help shape them to become these amazing scientists, it is so exciting because what we're seeing is people that, are really technologically stuck in and advanced, coming in and asking really good questions and getting really passionate about the area as well. So for me, I think together, what that drives is a growing force where we're really tackling those big questions as teams collaborating together, and that makes me excited. I'm an avid runner. I really like hiking. I pretty much like anything outdoors. What people may not know about me, well, actually anyone that hangs out with me for a little bit, I love karaoke. I'm very poor at it, but that doesn't matter. It's the equalizer of everything, because if you are willing to go out and sing karaoke, I know you have no ego, and I'm ready to be your friend and collaborator.